So with that, we have arrived at the last session of the event. And our esteemed speaker, Ms. Rania Lampu ma'am, has already joined us online. So before her session, I would like to briefly introduce her to you guys. So Ms. Rania Lampu ma'am is a distinguished global educator, STEM instructor, ICT teacher trainer, and researcher. She is currently serving at the Greek Ministry of Education's Directorate of Educational Technology and Innovation, where STEM projects for Greek schools are developed. Additionally, STEM instruction is provided at the Greek Astronomy and Space Company. Recognized with over 200 national and international awards, she has been honored as a Global Teacher Award winner 2019, 2020, and 2021 by AKS Awards and was a Global Teacher Prize finalist 2019 by the Voke Foundation. Her achievements have been featured in Passion Vista as a Global Icon 2020, Fortune among the top 10 women entrepreneurs, and Global Trade Chamber's 100 most successful women in business. Further acknowledgements include mentions in 30 Shining Stars of the World, Queen's Book 2021 and 2022, and Hosner Global Women Book 2023 by Hosner Media Group. Thank you, and over to Ms. Rania Lampu, ma'am.
So, warm greetings from Athens, from Greece. Am I audible? Okay. I would like. Yes, thank you. I'm very honored and happy to be invited here today. I would like to extend my hearty congratulations to all organizers of Summer Pan Institute of Nursing Paramedical Sciences. And of course, I want to thank you for the kind invitation. Today, I will focus on big data and nursing informatics. And as we gather here, I think we found ourselves under the section of innovation, technology, and compassionate care at the same time, all with one shared goal: to improve the lives of patients. So before starting share my presentation, I want to say that nurses have always been the heart of healthcare. They're the advocates for patients, they are guardians of quality, the leaders in delivering care that is responsive to the individual. But today we see an exciting transformation with the ability to capture and analyze vast amounts of data from electronic health records, wearable devices, genomic data, and more. Nurses are now becoming key drivers of data-driven patient-centered care, and this is more than just technology. It's about harnessing data to make smarter decisions, offer personalized treatments, predict outcomes, and most importantly, improve the overall patient experience. So today we will dive into these innovations, we will explore the real-world applications and discuss how they are transforming everything from personalized care plans to population health management. So allow me to share my presentation. Unfortunately, I have to stick to 30 minutes. Okay. I don't know if it's visible now. Can you see also the change of slides? Okay, thank you. So the integration of vast amounts of healthcare data with informatic tools has allowed healthcare professionals to provide a more personalized, efficient, and effective care. And this transformation actually is transforming the way nurses approach patient care with a stronger focus on individualized care plans and improved outcomes. Nursing informatics is this specialty that combines nursing science, information management technology, and focuses on how nurses collect, analyze, and utilize data to improve patient outcomes. So, nursing informatics professionals actually use data-driven technologies to enhance decision-making, to streamline clinical workflows, and foster better communication between patients and healthcare providers. Of course, the big data in healthcare refers to this amount of information collected from various sources such as electronic health records or patient monitoring devices, wearable technologies, medical imaging, lab results, etc. So we're going to see one by one these key considerations What about how we can enhance patient safety, patient engagement, empowerment, and of course, how we can improve our clinical decision making. At the same time, we will discuss about the challenges and considerations such as data overload, training, education, data privacy. There is the five V's, the volume, the variety, diversity, velocity, veracity, and value of data, the massive amounts, the speed, the types, formats, the accuracy, and the relevance of data. So all these sources offer the massive amounts of data which come from different sources. And of course, the applications that we're going to see have to do with predictive analytics. We will discuss about this because now we can analyze larger data sets of patient histories, and this can help us identify, for example, early warning signs of diseases, potentially improving preventive care. For example, predictive models can access the likelihood of developing chronic conditions such as diabetes or heart disease. More personalized medicine, for example, genomic data combined with clinical data, enables healthcare providers to design more effective and personalized treatment plans. The public health and disease, because big data now is used to track disease outbreaks and epidemics in real time by analyzing data from multiple sources such as social media, trends, travel patterns, and public health records. Of course, drug discovery, because pharmaceutical companies use now big data analytics to accelerate the discovery by identifying potential drug candidates, predicting drug effectiveness, understanding adverse effects. We can streamline healthcare process by analyzing the workflow, also data to identify inefficiencies, to optimize resource use, and of course, this way we can reduce the healthcare costs. So how does nursing informatics contribute to improving patient care? By enhancing, by providing actually real-time access to patient data, what we call evidence-based guidelines and clinical protocols, helping nurses make informed decisions. This actually reduces errors, speeds up the diagnosis, and ensures the application of the best practices in patient care. Improves patient safety because informatic systems such as electronic health records and medication management tools help minimize human errors, particularly in drug administration and treatment. Digital platforms enable efficient communication between healthcare teams, ensuring that patient information is updated and shared across departments seamlessly. And this, of course, reduces delays and misunderstandings that could negatively impact patient outcomes. By leveraging also data analytics, nurses can better understand patients' individual needs, their preferences, their health patterns, and this leads to more tailored care plans and reduces administrative burdens. Of course, the remote, I forgot to mention that now nursing informatics supports implementation of remote monitoring and telehealth services, enabling nurses to track patients' health data in real time and intervene early when it's necessary, especially for patients in rural or underserved areas. So we can collect, analyze data on patient outcomes. We can help healthcare organizations identify trends, areas of improvement, successful interventions, and this continuous feedback loop actually drives high standards of care and fosters innovation. So we call differences between traditional healthcare, data management, and the use of big data have to do with the data volume, the data variety, the velocity, the complexity, because now we deal with a much variety of data, with data sharing, interoperability, with more regulatory and privacy concerns. Of course, now we utilize cloud-based or distributed storage systems that are highly scalable and can handle large volumes of data. So why is integration of technology critical in modern nursing practice? Because of all the cases that I mentioned before, we talk about managing complex conditions. Modern healthcare involves managing more chronic and complex conditions, which require care coordination. Technology helps nurses manage large volume of patient data, track care plans, and ensure continuity of care. Technology provides nurses with access to continuous professional development, through online courses, simulations, virtual learning platforms. And this ensures that nurses remain up to date with the latest healthcare trends and clinical skills. Don't forget about the simulations that virtual reality and augmented reality technologies allow now for advanced simulations and clinical scenario training, improving nurse preparedness for real-world situations. Compliance documentation, because now electronic information records and other health information technologies make it easier to comply with legal and regulatory requirements by ensuring accurate documentation of patient care and automating reporting processes. So with the rise in data breaches, technology support healthcare organizations in safeguarding patient information through encryption, through access control, and secure communication systems, ensuring compliance with privacy regulations. How big data intersect in clinical settings? Very important to mention the clinical decision support systems, because nursing informatics actually integrates big data into the systems, providing nurses with evidence-based recommendations at the point of care. For instance, it suggests medication adjustments based on a patient's history, current medication, lab results, reducing human error, improving outcomes. It can help us using predictive modeling. Big data nursing informatics can help identify patients at risk of sepsis or other complications. And these systems send alerts to nurses and healthcare providers, allowing immediate intervention. About the workforce management, because we can analyze the nurse workloads, staffing levels, and patient demand trends, leading to better scheduling and resource allocation. This ensures what? Ensures optimal nurse to patient ratios, minimizing burnout and improving care. And at the same time, nurse informatics can use data to predict the inventory needs, predicting medications or equipment, reducing waste, and ensuring that essential supplies are available when needed. This management, of course, of records has to do with comprehensive data integration across different healthcare systems. So real-time access to comprehensive patient data, improving care coordination, and improve what we call documentation accuracy. Because we enhance automated documentation, this allows nurses to spend more time with patients and less time on paperwork. So data from various clinical devices can be automatically integrated into these records for better accuracy. And this helps researchers also to analyze larger data sets in order to identify patterns, outcomes, and best practices. And this contributes to evidence-based practice, ensuring what? Ensuring that clinical care evolves based on the latest findings. And also, we talk about population health management. Big data analytics allow nurses to track health trends at the population level. They can identify risk factors and at the same time implement preventive measures, especially for chronic diseases like diabetes or hypertension. And big data also enables nursing informatics systems to provide patients with customized educational resources on their medical conditions and history, improving patient understanding and self-management. We can track a patient's health, even remotely intervene when it's necessary. How big data helps nurses in providing personalized care? We talk about assessment. A nurse can use big data to assess a patient's risk of developing conditions based on their medical records. So gather and access comprehensive data on the patient's health, including the medical history, the genetic information, the lifestyle, environmental conditions. It's about real time, allowing for early detection. Then I mentioned about the predictive analytics. For example, for cancer patients, nurses can leverage predictive models that analyze the patient's genetic data, the treatment history, and response patterns to help recommend the most effective chemotherapy or radiation regimens based on similar cases. So, improve care coordination. We can identify individual risks and using these predictive models, and at the same time be ready for preventive care, optimize medication management, For example, for elderly patients taking multiple medications, big data analytics can help nurses identify potential drug-drug interactions and suggest alternatives or dosage adjustments to avoid adverse effects. And of course, there is a precision in post-discharge discharge care because after a patient is discharged, nurses can use big data to monitor patient outcomes and adherence to care plans remotely. Mental health monitoring, very important, including data from apps, from wearable devices. This allows nurses to track a patient's mental health over time. So by using these tools, nurses can provide personalized mental health support and interventions based on the specific triggers or conditions a patient is experiencing. For example, for a patient who has depression or anxiety, nurses can do what? They can monitor data from mental health apps to identify patterns in mood changes or behavior. And this provides personalized counseling, also therapy recommendations. So we talk more and more enhanced patient engagement because nurses can now define the best methods of communication for individual patients, whether this is face-to-face interaction or phone calls or text reminders, and adapt their engagement strategies accordingly to ensure better adherence to treatment plans. And in what ways can nurse informatics improve patient engagement? There are all these patient portals which allows patients to access their own health records, the lab results, the medication lists, appointment schedules. We talk about transparency now, and this transparency gives patients more control over their health and fosters informed decision making. Informatics tools can provide educational materials tailored to individual patient needs, helping them to understand their conditions, the treatment options, self-care practices, which improve self-management and health outcomes. Facilitates the communication, two-way communication between patients, healthcare providers, for example, through secure messaging systems or telehealth consultations or mobile apps. We talk about an ongoing dialogue which allows patients to do what? To ask questions, to clarify concerns, to feel more involved in the care decisions. And at the same time, collaborative tools to collaborate with other healthcare teams to provide coordinated care, keeping patients informed and involved in decisions about the treatment options. So more data-driven insights, targeted alerts and reminders, the remote monitoring, and mention how to encourage self-management through mobile apps, and mention real-time feedback. Patient-reported outcomes or service and feedback are important. Decision support tools and patient decision aids. And how to build trust and confidence because I mentioned before about transparency now and accuracy. So very important that now we can predict the patient outcomes. How? By identifying risk factors and patterns, by predicting disease progression, predicting hospital readmission, because we can identify patients who are at high risk of being readmitted to the hospital after discharge by analyzing factors such as prior hospitalization records or socioeconomic factors and comorbidities. So hospitals and care teams can therefore intervene with additional support or follow-up care to reduce readmission rates. So these predictive models mentioned before, based on patient genetic makeup, on lifestyle data, clinical history, AI now and machine learning, all these learning models can predict how patients might respond to specific treatments or interventions, allowing doctors to make more informed decisions on the best course of action. This is what we call personalized predictive models. And at the same time, we talk about precision medicine, because big data enables precision medicine with tailored treatments based on the patient's genetic makeup that I mentioned before. And by analyzing this, we can help healthcare providers design therapies that are specifically suited to an individual's biological profile, minimizing this way adverse effects and optimizing outcomes. For example, in oncology, big data helps identify which cancer treatments would work best for a specific genetic mutation or cancer subtype, leading to better response rates. So this helps us to design more dynamic and adaptive care plans, helps us with decision support systems, and of course, the benefits is what I mentioned before. It's about early detection, it's about improved outcomes, reduced healthcare costs, and how these tools enhance communication, especially between patients and healthcare providers. I mentioned before about electronics health records. And this allows providers to access comprehensive, up-to-date patient information anytime, anywhere. So this facilitates more accurate discussions about patient care, whether in person or via telehealth platforms. It's about streamlined communication because nurses and other healthcare professionals can update and share patient data immediately with the rest of the team. And this reduces delays and ensures that everyone involved in the patient's care is on the same page, minimizing misunderstandings. It's about direct communication tools, online platforms, like portals where patients can access the health information, communicate with their health providers, schedule appointments, etc. And of course, this promotes engagement. Securing messaging systems for instant communication, continuity of care, because these secure messaging tools ensure continuity of care by allowing patients to follow up on their conditions or ask questions between appointments. And healthcare providers, of course, can respond to quickly without needing an in-person visit. Remote monitoring tools, which enable continuous communication, clinical patient support systems, so enhance information sharing, reducing communication. The chatbots not only offer night and day access to communication, but also what we call pre-consultation preparation, because virtual assistants, AI assistants, can gather basic information about the patient's condition before an appointment, so allowing healthcare providers to have a more focused and efficient conversation with the patient during the consultation. The social media, of course, data analytics and feedback tools. So some examples of patient health technologies is I mentioned before, for example, patient-generated health data. It's about wearable devices and mobile apps such as smartwatch or fitness trackers or health apps which collect data such as steps taken or the heart rate or sleep patterns or even glucose levels. So patients can share this data with their healthcare providers to adjust care plans and monitor chronic conditions like hypertension, etc. Here also we talk about chronic disease management because we can tailor treatment for chronic disease patients based on real time, as mentioned before. So personal health management apps, symptom trackers and education. These are apps that allow patients to track symptoms, to pain levels also, or mental health concerns with tools for managing conditions like asthma or anxiety or depression. More interactive, talk about more interactive health education, how AI also helps us a lot, and patient safety technology is here what we call, for example, the barcode medication administration, because this technology actually allows nurses and healthcare providers to scan a patient's medication barcode, to ensure that the correct medication is administered at the right time and dose, reducing medication errors. And secondly, we call smart infusion pumps. These pumps are equipped with sensors that can automatically adjust the medication delivery rates based on the patient's condition, reducing the risk of human error and ensuring the correct dosage. So many options that we have here, some examples of technologies. Interactive telemonitoring also I mentioned. How we can improve clinical decision making. Already mentioned some things, but this evidence-based decision making is very important because we make decisions now that are based on the latest evidence and best practices. For example, a nurse treatment, a nurse who treats a patient with a respiratory condition, can quickly access evidence-based guidelines for medication management for respiratory therapy and care intervention, ensuring that decisions are aligned with the most current standards of care. Big data systems, when they are combined with tools like electronic health records and wearable devices, provide nurses with real-time patient data and alerts at the same time. For risk assessments, we can streamline diagnosis, we can optimize the care condition, we can enhance at the same time critical thinking and diagnostic skills, because big data provides nurses with access to a wealth of information that can enhance the critical thinking and these diagnostic skills. Why? Because by analyzing patterns, outcomes, and large data sets, nurses can gain deeper understandings and insights into patient outcomes and make more informed decisions in complex situations. Post-discharge planning, that I mentioned before, and improve clinical workflows. So what decision support systems are available? Clinical decision support systems have to do with alerting systems with guideline decision support. These can recommend care protocols based on best practices or clinical guidelines. For example, when we manage a diabetic patient, the system might suggest the glucose. For medication decision support systems, here, what are the characteristics of the system? For example, dose calculation, the drug interaction checks, warn clinicians about potential harmful drug interactions in real time. It's amazing. Medication safety alerts, flags medication that may be inappropriate for certain patient conditions or characteristics, for example, for pregnancy. We have up-to-date clinical decision support tool that offers the recent evidence. Cochrane Library provides systematic reviews of healthcare interventions to support decision-making and clinical pathways, which actually are standardized in evidence-based guidelines. Risk assessment, predictive tools examines the early warning systems, which can help us with spotting patients who are at risk of deterioration, analyzing the vital signs, or the SINPS prediction models. At the same time, the full risk assessment tools like the Morseful scale actually evaluate factors such as mobility, medication use, etc. The symptom decision trees are algorithms that guide clinicians through a step-by-step process of considering various diagnoses based on patient data, clinical signs. The order sets and protocols. An example, we can mention pediatric or post-surgical order set. The SINPS protocols, and also charting, the nursing technique support, so charting documentation decision, the coding assistance suggests proper coding for diagnosis, for treatments and procedures. The telemedicine virtual health platforms, the flowchart-based support, decision support embedded in workflows and provide recommendations. The AI systems, so risk stratification. These algorithms that analyze patient data to predict outcomes in natural language processing. And with all these possibilities, we can identify early warning signs of patient deterioration. We have risk stratification, predicting accurate events, improving communication, the post-accurate care and follow-up. What types of data are most useful for preventing medication errors or detecting potential safety risks? These types of data, as I mentioned before, patient health history, laboratory diagnostic data, medication administration data, drug interaction data, pharmacy data, all these are important, are precious for preventing medication errors. And of course, big data contributes to reduction of hospital-acquired infection and other adverse events. Through antibiotic stewardship, enhanced hygiene, cleaning protocols, tracking monitoring surgical sites, another very important issue has to do with health population health management. And this, why? Because big data can help us now first identify and address health disparities. We can understand how now big data can reveal that a particular low-income community has higher rates of asthma due to poor air quality. So nurses now can do what? Can coordinate efforts to provide better asthma management, educate the community about environmental triggers, and advocate for policies to improve air quality. For example, another issue to predict disease outbreaks. During flu season, big data from emergency room visits through related searches online and public health reports, this can help predict potential outbreaks. Nurses can use this information to increase vaccination efforts and educate the public about preventive measures. Many amazing possibilities. We can monitor trends in blood sugar levels among diabetic patients. So, for chronic disease management, the resource allocation can help us behavioral social determinants on health. They might reveal, for example, that low-income families are more likely to experience preventable hospital admissions due to poor nutrition. So nurses can work with community organizations to provide access to healthy food, education, and affordable nutrition support services to address food security. More targeted public health campaigns. This can help improve vaccination, immunization programs, reducing health disparities, and so many insights that nurses can gain through emerging, for example, identification of health patterns that could be emerging infectious diseases or seasonal geographic variations, through risk prediction, through tailoring treatment plans. So actually informatics can help identify health disparities at risk population also. In general, of course, this helps with policy making by targeting public health interventions, behavioral sentiment analysis, monitoring health equity, and disparities will help us with global health and cross-border collaborations. And the data from community-based health programs, of course, can be integrated into nursing care plans. We need to leverage incorporating social determinants of health data, the collaboration with community health workers, patient education managers support, all these health information exchanges, all these very important data that we can integrate into nursing care plans. Of course, help us with workflow, optimization, and through clinical communication tools, patient flow management tools. The benefits of automating data entry, of course, has to do with time saving, with cost savings, with streamlined communication, more enhanced compliance, and regulatory adherence, better job satisfaction, improved, of course, patient satisfaction. The reduction of administrative tasks also is important. The common challenges before concluding have to do with more time for direct patient care, better workflow, the faster access to patient information, the improved data for research, the cost savings, etc. So, of course, there are challenges. But these amazing tools that we have, for example, wearable devices, which help with data-driven support and support for clinical research. Let's not forget about the ethical considerations. The ethical consideration is very important to talk about the healthcare sector. Data privacy, data quality, interoperability, the data overload, the lack of standardization, and how healthcare organizations can address these concerns, these challenges by encryption of data, by regular audits and monitor, by securing data storage, by setting up a data breach response plan. Of course, through patient consent control. Blockchain technology is important for enhanced security. Of course, what steps before concluding can be taken to prevent data overload? When we work with large healthcare datasets, of course, we start with data prioritization, then aggregation, use of advanced data analytic tools, then we develop clear data visualization techniques, the data governance, we segment, we structure the data, we implement role-based data access after the regular training, we try to balance real-time data with historical context, data compression, and clear documentation communication protocols. Very important steps that you need to follow ongoing training and education is important for nurses if you want to use these informatic tools. So optimizing patient care and safety, we have to incorporate data analytics. We need to train on this, and of course they need to be ready to face these ethical issues that may arise, such as data accuracy, the bias, discrimination, the data ownership, the informed consent, the equity in data access. The future trends, magic trends in nursing informatics, also related with AI, cloud-based healthcare systems, blockchain, robotics, automation in nursing. You can think about how you see the role of artificial intelligence, how this has improved your work, the diagnosis, the personalized care, and of course, these advancements in wearable technology are expected to impact nursing practices through continuous remote patient monitoring through this wearable for medication adherence, pain management, echocardiograms, smart clothing, etc. So we could say, conclude, thanks a lot for your attention. You know, I can speak for hours, but I know I have to stick to the time. Thank you very much for giving me this opportunity. If you have any questions, of course, we can discuss.
Thank you so much, ma'am, for this informative session. It was good to have you with us today. Thank you so much, ma'am.
Thank you for this opportunity. If you have any question, of course.
Anyone has any questions from the audience? No, ma'am, no questions from the audience.
Okay, thank you very much. Thank you.
So now we will take a break. It's time to have your lunch. The designated venues, I'll repeat for one more time. All the guests, speakers and chairmen, your lunch has been arranged in the VIP lounge left toward from the outside, and all the student delegates and faculty delegates, your lunch has been arranged in the ground. Thank you.